This conference will now be recorded.
Well, good day, everyone. My name is Dawn Ringrose, and I'm Principal of Organizational Excellence Specialist. I'm here today as moderator with our host, Dale Weeks, who is a registered Organizational Excellence Specialist with us. He's located in the United States. Dale's earned a BSc in mathematics and an MBA in finance, and he's a real seasoned professional in the excellence area with proven business results. He's been involved in leadership and management positions with very innovative public and private sector organizations such as the Minnesota Department of Revenue, the Florida Department of Revenue, Control Data Corporation, General Mills, and Xerox Corporation. As a volunteer, he served for many years on the Global Benchmarking Network. So he's here today to talk about healthcare excellence and the way forward. And I just know that he's going to tap into some wonderful examples that we can learn from and discuss simple, straightforward, and time efficient, cost effective process for those that are interested. So take it away, Dale.
Okay, thank you very much, Dawn. We'll begin. You should see the sharing the slide. I hope it's up on your screen. Healthcare excellence, the way forward. And what I'm going to talk about today is the global healthcare sector and where we're proceeding and where we're going. So let's proceed. All right. I'm going to talk about the current state, how you compare to others, and what you can do to improve your performance going forward. Once you've got a sense of where you are, whether it's in a hospital, whether it's in a clinic, whether it's in your country by country's healthcare system, then you'll get a sense of how you're doing, how you compare, and then how we can proceed from there. So let's proceed. Okay, let's start out with some definitions. Dawn mentioned, yes, healthcare is very everything we do, good mental to a high quality of life, and our collective ability to enjoy life. If you have children or have had children, family, healthy child is able to grow and develop and contribute to our global society. A healthy citizen is able to be educated, solve the problems of our world, contribute to society, and then a healthy society is better able to contribute to better overall outcome. And what do I mean in terms of outcomes? I'm talking about the ultimate results of your country or state or local healthcare system. So this applies to what I've indicated here on this slide. Anywhere on our planet, now this is a global perspective, we have close to 8.1 billion people if the estimates are accurate. And I've identified three major areas here that relate to outcomes that I would advise that we are seeking in any country's healthcare system. Eradicate all major diseases. When I was growing up, a major disease was polio. We helped eradicate that in most countries. It's not 100% yet. Major diseases of the world today, things like Alzheimer's, Parkinson's, multiple sclerosis, just as an example. So we have an intent, a vision to eradicate major disease. That's an outcome we're seeking. Provide timely access to global health care. Each of us sits in our own local area, our own state, perhaps, our province, our country, and you have to ask the question, do we have timely access? When you have a health issue, a problem, can you pick up the phone? Can you go and get an appointment and have equal timely access to global health care? And to the final one is continually increase the life expectancy. You'll see some of the data later on in today's discussion about where life expectancy is on a global basis. And in some countries, including where I sit here in the United States, during the COVID period, that has decreased. So this is what we're looking at in terms of outcomes for our healthcare system. Now, take that specifically into what we're going to talk about, or what I'll talk about today. The three areas: what's your current state of your healthcare system in your country, or the current state of your healthcare system in the state, province, or region where you exist, or in the current state of your most immediate, your doctor, dentist, or whatever. Current state of any entity within the healthcare system. How do you compare? If you're going to move forward and continually improve, compared to what? If I sit here in the state of Minnesota, how do I compare to other states? How do I compare to other countries? So I compare and I set some direction. It's like being in the getting ready for the Olympics. If I think I'm a good performer, how do I compare? And then what do I do? Once I find out what my competition, my other countries are doing, what can I do now to continually improve and strengthen my organization? So that's what I'm going to talk about in terms of our global healthcare system. This next slide, can't read it. What it is, it's just an attempt to give you, and I extracted this from one of the reports on our global healthcare systems across the world. This is a flow chart, a business system flow chart that you can classify it at. And it's got the elements of our United States healthcare system. I could pull up probably a similar diagram for most other countries in the world. So you look at this and there's a combination of public financing, private financing. There's hospitals, there's state and local healthcare agencies, all kinds of both public and private entities. And it's similar in other countries. And so what you want to look at in terms of what we're talking about here, performance excellence, this whole sense of what is a system. This is a healthcare system. So then you ask the question, and we'll be talking about later, and you'll have an opportunity to participate in who is managing this healthcare system. If I say this is the flow chart of the United States healthcare system, who is managing that? Or is anyone managing that? Probably there's pieces, federal, state, local. How do they all work together to really get to those outcomes I talked about? So I wanted you to consider this in the context of all of the potential elements that you may touch. And the U.S. system here is represented in a mix of private, public sector, big pharmaceutical companies and so forth. So ask the same question. Now I want to stop a little bit and ask of those that are on the line or those that will look at this at a later point. On a scale of 1 to 10, how exceptional would you say your doctor or your dentist or your immediate healthcare provider is? And look at this in the standpoint of not just what does your doctor or your dentist provide in terms of their treatment, but include the total patient or customer experience from the time you set an appointment all the way through to the time you pay for your services you received. Whether it was paid for by some of those agencies I mentioned earlier, whether it's paid for by a private healthcare company, paid for by the government, how would you rate your doctor or dentist in terms of that total process? I've had some experience. Many of you could probably relate to that, where, yes, in the case, for example, of a dentist, very good dental treatment in terms of my dental health. But when it gets to the dental insurance process, what is covered? What is not covered? Do you have a discount? Do you not have a discount? Is certain things covered? So look at this. If you're the feedback, and Dawn is here, maybe you could want to provide some input. How would you rate your doctor or dentist in terms of a scale of 1 to 10? What's really exceptional? And when I get to the exceptional, I'll talk about it later. I'm looking at something beyond what you would normally expect. You walk into a dentist's office, you walk into a doctor's office, you expect to get an appointment, you expect them to be on time, you expect to be able to pick up the phone and talk to them. But what is it that's truly exceptional? in your total patient experience. And on a scale of 1 to 10, how would you rate your doctor, dentist, or if you want to substitute another healthcare provider? So Dawn, you're here with us today. Do you want to give a sense of, just in your case, how would you rate your doctor, dentist, or healthcare provider where you are in Canada?
Well, I'm going to say this with a little bit of a caveat because I've just moved from Alberta to, British Columbia, and I've just been in British Columbia for 11 years. And I would rate my current doctor at a 6 and my dentist at a 5. But, back in Edmonton, Alberta, where, I spent most of my life, I would have given them much higher ratings because the entire customer experience was just that much better. And, it takes some time to find the right professional. But here in British Columbia, I've been a little disappointed. The doctor doesn't have time to spend with you really if you've got an issue, and the dentist, I feel like sometimes you get scolded more than anything from the person, the hygienist who does your teeth cleaning, and then the dentist comes in and does a quick check, and and he's not bad, but the whole experience is not good. I mean, last year it was horrific. I went to go get my teeth cleaned, and she got through halfway through the cleaning, and she said, "Jill, I've got another patient waiting, and so you're going to have to come back tomorrow." And I thought, well, what is that? They have not
Halfway.
put aside enough time. I said, I live a half an hour away. And I said, that's a round trip. That's another hour out of my day. I said, come on, this is crazy. I said, I'm really disappointed. So anyway, that's just for me. I'm not real happy with the providers that I have here, and I'm kind of on the lookout for new providers, to tell you the truth. Yeah.
Yeah, well, I'll just give mine. Mine in recent, I had a very good dentist for the last 5 or 6 years. And here in the United States, specifically here in Minnesota, they have things called, certain ones are in the network or outside the network, which means they will take federal funding, they will take insurance of a certain one. So if you come in as a patient and you've got, a potential of 8 or 10 different insurance companies to cover you, they will cherry pick who they're going to cover. So I was 6 or 7 years, got very good treatment. I liked the dentist. He was very friendly. I enjoyed going there. But in February this year, they decided to go, as they call it, off network. So they weren't going to work with my insurance company anymore. But they, number one, didn't inform me. I just call up for an appointment and they say, well, you got to pay all this yourself now. Is that all right? And I said, you didn't inform me? And he said, we didn't have to. Didn't have to. It's a normal customer expectation. So that whole sense of the dentist was great in terms of what they did, but the whole effort. And then I had a case, a few years ago where I fell off my bike. I had to get an implant, and I had to go to the major insurance company, and you call on the line, and I got 2 or 3 different answers depending on who I called as to what was covered and not covered.
Oh,
they didn't have it. So I would put them, the dentist himself, in terms of service, probably 7 or 8. In terms of the total experience, 3, maybe 4, because they couldn't manage or had difficulty managing that payment process and everything involved there. So that's what I'm looking at for improvement. So, okay, let's go from that baseline. Everyone else that sees this, think in terms of your own clinic, but beyond that for the system as a whole. So what we're going to do here is just get into the process of, as I said, establishing a baseline for your healthcare system, whether it's a baseline for your dentist or your hospital or beyond that. And we start by doing that. Some of you have probably been involved with strategic planning. So you do an environmental scan to establish a baseline. So you look at internal and external things that impact your organization. You look at your strengths and weaknesses and so forth. So we're going to do that, or I'm going to do that for a healthcare system. So we look at opportunities It's called a SWOT analysis, SWOT, strengths, weaknesses, opportunities, and threats. So you look at what you're doing well, where you can improve, what are the opportunities. You're looking externally, outside your organization, for the country as a whole, establish your baseline, and then you can determine where you how you compare to others. So let's look at that for a number of sources that give you a baseline. So I'm going to talk about five plus a little one that I added on that I came across in the last several months. Reviewing about 5 valuable sources, and there are others. Those of you on could probably come up with others that you can use as a baseline, but looking at several of these in terms of what do they tell us regarding healthcare systems in the world. This is a global healthcare system. We're going to talk about this thing called the Social Progress Index. It's been 10, 12 years in existence. It looks at, part of many of their measures, the current state of our global healthcare sector in 12 components, 60 indicators across how many countries? 169 countries, an additional 27 countries, and they've also recently got into assessing states in the United States and cities and so forth. So you can look at healthcare across the United States and within other countries. Then we're going to look at a group from Europe, the Organization for Economic Cooperation. They do an assessment of both education and healthcare. And then there's a CEO World Magazine I've come across that's done a ranking. And we'll look at the global healthcare system rankings for just about all countries in the world. How well is the world doing in terms of providing healthcare to our global citizens to get to those outcomes? And then I'm going to look at another one that's been in the last several years, a group called the Commonwealth Fund. It was set up way back, not to look at healthcare, but way back in the early 20th century to look at common issues we face across the globe. Today, the mission of this Commonwealth Fund is to promote high-performing, equitable healthcare systems, a lot of words, better access, improved quality, greater efficiency, all of those things that we look at in terms of system performance, organizational performance. But their focus is on the most vulnerable. I talked at the beginning about access. If you're in Africa, for example, or if you're in some of the other more developing countries, what access do the people have there? People of color, people with low income. We have a private sector system here, mostly in the United States. Other countries have a public that says you should have access to healthcare. So I'll talk about the Commonwealth Fund, and then this thing that I've mentioned and many others, this organization called Gallup out there. What do they say about employee engagement? We've just been through, in most countries of the world, were touched by COVID. What does that do to your healthcare workers? And what does Gallup have to say about that? And then we'll conclude by talking about our Global Organizational Excellence Index, some of the great work that Dawn has done and others to really assess how well healthcare sector is doing compared to other sectors. How does healthcare sector compare to education? How does healthcare sector compare to the private sector? Dawn mentioned I started my career in the private sector. I worked for large organizations, Xerox, General Mills, Control Data, large organizations, but then also worked in the public sector. So how does healthcare in our major healthcare institutions, how does their performance compare to these other ones? People say, gee, should you go to work in the healthcare sector? Well, let's see how they compare. Then we'll take the global organizational excellence and say, what can you do next? We're going to conclude with a sense of what can you do? If you're a part of, as I've indicated in some of my emails, this global healthcare sector coalition of the willing, people who want to make for change in the world as far as our healthcare sector. How do we do that? How do we go forward? Okay, one other interactive discussion here now. Similar to what I said earlier in terms of doctors, dentists, and your own performance. On a scale of 1 to 5, how exceptional did your country perform during the recent COVID-19 period? From 2020 to 2023, 24, perhaps you're still addressing some of those. But on a scale of 1 to 5, how exceptional did your country or your state perform? Now, I can give my own personal situation where I sit here in Minnesota. When I first started going through and we were introduced that COVID was there, how do you get your first vaccine shot? Did I go to our state agency or my own personal health care system to find out where I get my vaccine? Yeah, I did. They had no answer. What did I end up going to? I went to a friend of mine who had a network of people who knew where the vaccines were available. So nothing to do with any agency. I went to there and she sent me a text message and said, go to this place, they've got vaccine. So my state system or even the federal system, probably on a scale of 1 to 5, maybe if I'm an optimist, I give them a 2 or a 3. Dawn is aware we did a study of country by country assessment during COVID, and so maybe we get some countries that were in a 4 to 5, but here in the U.S., I would probably give them a 2, 3, maybe, in terms of what they could do differently, and the importance of vaccines and the importance of science in terms of understanding the rationale. So that's where I would stand in terms of it, because it's, again, I'm saying exceeded my expectations, a wow factor. In a lot of assessments that I do, whether it's going to a restaurant or feedback from a hotel, they ask you 1 to 5, how did we do? And I might say a 2 or a 3, and they say, why did you not give me a 5? Because it wasn't beyond my expectations. It wasn't a wow factor. I think I've been involved in this long enough. I know what exceptional performance is, but they didn't do anything beyond what I would normally expect. If I go on an airplane, I expect them to go from point A to point B and get me there safe and sound. But then you got other things of how they do their service on the plane and so forth. So in terms of how did your country perform? And how exceptional did they do during COVID? Dawn, you want to share maybe a little bit on how you think Canada did in terms of expectation?
Yeah, I wouldn't mind sharing. And what I noticed at first, the government came out with policy and asking the entire population to participate in their campaign. But there's also been a fair bit of controversy about it too, because there's been a national citizens inquiry, taking a look in greater detail at the policy and the consequences of that policy. So
Yeah.
I think the population here, might be a little divided in terms of the way that went. At first it seemed to be going quite well, but as time went on, I think that there are people questioning now if it was well thought out and based on evidence, and probably if the science was there to support what they did. So I think there'd be a mixed reaction here. I'd say I'd probably have to provide a neutral score, just as I was sitting back examining it.
Yeah. Okay, fine. And I've gotten various material in the last year or two from our, post-COVID, if you want to call it that, assessment. And when we went through the assessment, I think we had New Zealand was at the top of what they did. There's an island community, and they were able to establish a little more control over, the COVID situation and so forth. But again, this is just an exercise to give you a sense of how do you assess your country's performance. Because I gave the initial flow chart. We've got federal agencies, we've got the Centers for Disease Control, and then globally we got other organizations. So to give us a sense of how you want to assess it, because this is what I'm looking at in terms of when we get to the outcomes, That's what you want to build on. So, okay, let's take that then and go into some of these sources. The Social Progress Index, I spent some time talking about that. Let me give you a sense of what this is. And it's leaders in various sectors of government that use it to understand strengths and areas for improvement and what you can do. So let me show you what they have to say about healthcare. So let's just drill down from the top. Social progress, and this is the 2024. It's been around for 10, 12, 15 years or so. In 2024, this is about, I think early April, early part of this year. 61 countries saw a decline in their social progress in 2023. 74 stagnated, and only 32 countries saw real progress. So what this is built on, the Social Progress Index, it started with some gentleman from the Harvard Business School, Michael Porter, who said, gee, where we normally measure countries is by GDP. So you can do the G20, the G7, you can look at United States, China, Japan, all of these in terms of GDP, gross domestic product. This Social Progress Index goes much beyond that and says just economic development is not sufficient, necessary but not sufficient to indicate the progress that a country's been making. So this is what they've reported for 2024. And let's just drill down from that to what is it for healthcare. Okay, this is the top level. And they have 3, 4, 5 tiers of all countries essentially in the world. And you look at this, and you say tier 1, these are the top countries that are doing overall social progress. This is not just healthcare. But you look at, where do I jump? Oh, jump to United States, 29th in the world. And then you look at their other indicator here. What's happened in the last year or country? Even the ones in the Scandinavian countries that are doing well, annual change has not been substantial enough to reflect that. So you see this, they're either in yellow, it means they've stayed the same, or they went down. Where's the United States? When I look back probably 3, 4, 5 years, the United States was at 16th. Now the United States is at 29th. And all of these other countries are doing greater in terms of the 60 or so measures that they look at. We're not going to spend time today, but I want to take this and say, this is where the United States is. And then you want to drill down and say, what are we doing for the healthcare area? They've got 2 areas that they've identified. You see all these other categories, but the ones I've highlighted here are health and wellness and nutrition and basic medical care. This is from 2011 to 2024, 13, 14 years or so. And this is the increase over that period of time. So health and wellness for the globe as a whole, that's gotten better. Nutrition has gotten better. And whereas it declined, you see at the bottom, personal rights, inclusiveness, all these things we hear about of diversity, equity, and inclusion. So that's where the world stands. Now on a country by country basis. Let's look at that. Now here, they're looking at things. I won't go through all the measures. They're looking at access. They're looking at quality of health care. They're looking at mortality, life expectancy, satisfaction. So they break this healthcare thing down into 4 or 5 areas in terms of assessment. And this is a summary level just to isolate a few countries to show you where they stand according to the SPI. United States, similar to SPI overall, 40th in terms of healthcare ranking. India, 102. Norway, there you get down into some of those toward the end. Norway, number 3. Japan, number 3. Germany, 15th. That's one of the countries in terms of GDP. You take United States as highest in GDP, but 40th in healthcare. Canada, 18th. The top 1 or 2, Singapore and Switzerland. So this is the basis to say, gee, somebody's doing better than we are. And I'll go in a few minutes what some of the reasons are behind this. But this is the ranking. So you say, gee, if I'm going to go forward and improve, do I want to say, look at the United States and look at Switzerland? benchmarking. I won't spend a lot of time today. I have another course that we've developed through OES on benchmarking. But to be able to say, gee, do I want to get to where Switzerland is, or do I want to get to where Japan is? Then I ought to do some structured, formal benchmark to see where we are. And that's the basis for what SPI has to say about healthcare ranking. Now, that's one source. Now, let's look into this OECD. They actually put together a healthcare at a glance, similar to what they've done for education. And I've got a link here. You can, when you get the copy of the slides, you can access these links and look at them. But I'm going to summarize a little bit of what they have to say about healthcare at a glance in 2023. Similar, but a little different analysis than what the SPI had to say. Here's one slide that I pulled from a foundation that exists here in the United States, but it's one slide related to what the OECD has to say. And this says the United States spends more per capita, that's per person, than twice that of the other average of the wealthy countries in OECD. So the United States spend $12,000 per capita. The average for the OECD countries is $6,000. So we spend more per capita than any other developed country in the world. And our outcomes, as I indicated earlier with some of the SPI, our outcomes are less. So that's the state where we stand. That's what OECD has to say. And there are other slides I could put up here. But then let's look at, this is the CEO World magazine that I mentioned. This is their ranking. And here we are. Taiwan has been ranked as a country with the best healthcare system in the world. Do they do the same criteria? No, a little different than what SPI and OECD is, but Taiwan is the top in terms of medical infrastructure, availability, government readiness, healthcare index overall. So you see Taiwan, South Korea, Australia, Canada, Sweden, United States, I didn't put them all down there, is 15. And the European countries, some of them are there, but they're not doing that well. So again, you put this against the GDP kind of figures. Taiwan is not in the top 5 in GDP. Canada is there. Australia is doing well. But this is what CEO magazine says in terms of that. So you can look at these various sources and say, gee, there are distinct areas for improvement. Now look at this other organization I found, a Commonwealth Fund that existed. Its mission today is to promote high performing. This is just one study they did in the last few years. Again, in their estimation, the United States, in terms of these countries, select countries, is last on the list. The first is the Netherlands. And you got New Zealand there and Sweden. So in the case of the Commonwealth Fund, same rankings. The U.S. is not doing well, and there are all kinds of reasons for that, but that's the basis by which they make it. So the net of this is the United States, if you isolate that country, trails far behind other high-income countries on measures of healthcare affordability, because our system, as I gave, the business system flow chart, if I can call it that, has a lot of private sector components in it. We have big pharmaceutical companies. We have big insurance companies. We have one here in Minnesota called United Healthcare that is in the top 1 or 2 of healthcare insurance companies. And our outcomes are not where they need to be. So these are the basis for which you say, okay, if you're involved in one way or another of our assessing our healthcare system, whether it's the United States or whether you take Germany or Japan or Canada or whatever country we happen to be dealing with, the data is out there. This is publicly available data that you can look at. Then you're going to determine again, as I mentioned earlier, okay, are we going to try to improve? You're going to go to Netherlands, you're going to go to Norway. How do you do some formal structured benchmarking to actually set your improvement path in place? So that's the basis by which assess them. But then what does a Gallup organization, For those that don't know it, if you're outside the United States, the Gallup organization has existed in the US probably 20, 30 years ago. When I first started voting, they were doing polling in elections, but they have expanded quite extensively in recent years. Probably when I was at the Minnesota Department of Revenue dealing with performance excellence, we actually used a Gallup survey probably in 1995, 97, 98. But they've been involved in employee engagement. How engaged are employees in general? And they've gotten, I think I saw something in the, over 100 countries now that they've got employee engagement. And in this is just our most recent assessment. This is the positive side. As an optimist, you may want to look at this and say, oh, 23% of organizations in general have employees who are engaged in one way or another. But the opposite side of that says 60-some, 7%, 80%, whatever the case may be, are disengaged. So that whole sense of employee engagement, and what do they have to say about the healthcare sector? Leadership and management vision. Highly engaged staff make the difference in overall healthcare outcomes, patient outcomes. If you've got an engaged staff, if you go to a hospital and you've got a nurse, you've got a doctor who you trust and links to you, Don mentioned, you go earlier when we were talking about how much time do you have in your appointments with your doctor. Here in the United States, the numbers vary, 7 to 10 minutes in an annual physical. Do they get to know what you are? In other countries, it say, I think I saw something recently in Japan that says their people in general have 3 to 4 to 5 checkups per year to focus on where they are. They have a commitment to do that to the outcome. But what is the reality that according to the Gallup data, among all employees, healthcare professionals, the biggest slump in engagement scores dropping 9 points for healthcare, 2021. This is compared to many other industries, compared to education and so forth. So think in terms of what the question I asked earlier of how well did they do during COVID. We had a lot of reports around here, and we have continuing ones. We have hospitals that the doctors are filing to, number one, join the unions, number two, to potentially go on strike. Same thing with nursing. How do you get high engagement if you're going on strike? So healthcare has got a big opportunity here to build on their employee engagement. So then there's one final discussion question I want to pose to those that are here today or those that are listening. What is one unexpected service excellence best practice you have observed in your last year from your doctor or dentist? So you go to your doctor or dentist or your healthcare provider and you walk in. What have they done? Something that you experienced that you would consider based upon who you are as an individual, what exposure you've had to this performance excellence. What unexpected best practice would you say that you observed because of or whether it's a friend, family, or somebody else in the last year? Because we're going to spend some time as I conclude this on talking about best practice. So what is one best practice that you have seen in your doctor, dentist, or other healthcare provider? Something that, again, perhaps you didn't expect. Dawn, would you want to offer anything here? I think you mentioned some of that before. Anything you would like to
No,
add?
there isn't anything that really comes immediately to mind, but I might ask some of the other participants here to weigh in because they might have some feedback too. It's always interesting to hear from others, if other people here have got something to contribute.
Yeah. Okay. Well, we can take that as we go and when others contribute and so forth. But
yeah, I figure that they're kind of going through the motions. You kind of feel like they're they're churning through the patients. do you really get, it seems like it's pretty average to me.
Yeah.
I don't think that there's anything standing out in terms of an unexpected best practice, something that really wowed me, to tell you
Right.
the truth. So I think there's lots of room for improvement. And, maybe if I was to say, maybe more personalized, maybe be treating you in a more human way rather than just the next patient that they're putting through the system, kind of like almost like a manufacturing plant,
Yeah. Well, I'll talk a little bit when I get a few minutes
Okay.
down to some success stories. I'll talk about, Dawn and I have discussed this in recent days, of Mayo Clinic, which exists here in Minnesota. It's about 90 miles from where I sit. Mayo Clinic is known across the world for their exceptional healthcare service. So I'll talk about some of their best practices. But so all the participants think about that as we go through the rest of it. Okay, I've been through all the sources now prior to this. Now let's drill down finally into our global OE index. What is it? Why are we doing it? Where did it come from? This global organizational excellence index, Don got it going 10, 15 years ago. What we've done is focus on leaders in every sector, whether it's be today, we're talking about healthcare, government, education, business, not for profit. Is we've taken these excellence principles, best practices, and so forth, and integrated, brought them all together of the leading models. I've heard a little bit about my background. I started in 1985, 87. I was part of a government commission here in Minnesota where we got the first Baldrige organization, support organization going. It was called the Minnesota Council for Quality. So the Baldrige got going here in the United States. There was one in Europe called EFQM. There's a Canadian Excellence Award. There's one in Australia. And so all of these were brought together to build a sense of the organizational excellence framework. So whether you're doing some of this work in Europe, whether you're doing it here in the United States, whether you're doing it in any other country of the world, there is a framework. And it provides this index, and the approach provides guidelines for moving forward, the basis for an assessment tool to find out where you are today in terms of this excellence. I mentioned at the beginning, we're going to put a stake in the ground. So that's what this organizational excellence framework and tools are all about. What is it? If you haven't had an introduction to it, this is the wheel, if I can call it the OEF wheel. It's got three levels. On the inside, you have 9 principles, and we're not going to talk about all of those today. But what this gets at is the management community in general, whether it be management and leadership for healthcare, whether it's education, whether it's where I came. Dawn mentioned I have a master's in business administration. A lot of the progress, if you want to call it that, over the last 20, 30 years is what we call flavor of the month or flavor of the year. There's things like Six Sigma, and there's things like design thinking, and there's things like team. And organizations sometimes cherry pick and choose. What we've done here in this OEF organizational excellence framework is said there are 9 principles here in the inside of this wheel that relate to, and it's been proven over 30 years. I got started on this stuff back in the 1980s. Proven over 30 years that an organization that's building a culture committed to excellence uses and applies these principles. So that's what this is, a formula for success. You look at it, I'll talk in a few minutes about success stories. Those that adhere to this, they don't get distracted by the flavor of the month. They might do some of that somewhere in there, but they have a broad strategic look at the entire organization. So then you want to look at this even in a healthcare system basis. Do we use this to manage? So this is the principles on the inside. On the next level is the best practices, and then the outcomes that I mentioned at the outset. The outcomes that we've got, how we do continuous improvement, is the result. So when I worked in the Florida Department of Revenue, if we would go to the governor or we would go to the legislature and say, how are you doing? We wouldn't necessarily bring in all of this stuff here. That was there. That was, as I call it, under the hood. But we would bring them the results. And we had cases where they said, oh, we want to privatize certain things you're doing. We want to privatize how you do audits. We said, we have our result. They went in and tried test cases to do audits in the private sector. We exceeded the expectation, so they took it away from us and then ended up giving it back to us. So this whole sense of showing your measurements, and if they choose to look at how you're getting there, we shared that with whoever was interested. So these are the principles, the 9 principles that were in the wheel there. I won't go through all of them. Customer focus, I talked about engagement, that's people involvement, continuous improvement. So somebody managing an organization in the healthcare arena ought to be looking at these, and we can share with you if you want an idea at some point what those principles are. Those are the 9 principles. And then we have results. What we've done is an assessment over the last several years against these 9 principles. We have close to 2,100 respondents, and we did it by selected sectors. So you see here 15, 20 or so sectors, and you can see here in the middle is where human health and social work. So we've gone out and looked at respondents and asked them, how well do you think you're doing? That's the assessment. Get the stake in the ground. And the rating here is subjective, and we have all of the detail on that. So you can compare how the healthcare sector is doing against the other one. Again, another basis for determining potential benchmark. Can you benchmark, the ones at the higher here, administrative and support service? To some degree you can. Benchmarking is not that easy in terms of, it's a silver bullet, but set a basis for what are they doing right? Because there's common elements here. I've worked in the private sector. I've worked in the public sector. I've worked with clients in the not-for-profit sector. The common principles are very similar. They would say the word or phrase used in the benchmarking community is NIH, not invented here. Well, I've worked on both sides of it, and 60, 70, 80, 90%, very similar. You look at what I did in some of the private sector, some of the winners of these Baldrige Awards and so forth, similar kind of principle. So this is the principles by specific industry sector, the results. And then we have the same thing for the key management areas. 9 areas that expand beyond the principles. They get into strategic planning, business planning, customers, how you interact with your customers, customer satisfactions, work processes, all of this stuff. So you can apply this in an organization or you can apply it in a healthcare system. And these are the results. Again, close to 1,000, and our target in many of these assessments is to get to 5,000, 8,000, 9,000 or more organizations that can assess where they are. And you see human health here is about a 5.18. Yeah, well, lots of room for growth, but again, for the key management areas. Okay, now you've got a sense, at least at the introductory level, what this organizational excellence framework is. Who are the high performing ones out there? Where are the success stories in government, business, healthcare, wherever? And these use that to benchmark and learn from. What do these organizations do? They go out. I worked for the Florida Department of Revenue. We went out, strange as it might seem, a tax agency went out and benchmarked how we process boxes of tax form. Who did we compare ourselves to? FedEx. So this is not necessarily you stay within your own sector. You go outside that sector. So let's look at some of those success stories that exist, at least from what I have seen, where I have been. The best managed healthcare organizations in the world. Okay, I've talked about the Baldrige winners. That's in the United States. I went and did my background look over the last 10 to 15 years. There's 28 hospitals or healthcare centers, 28 that have applied and have won the Baldrige Award. But, and I can tell you the names of some of those. There's one called Robert Wood Johnson Hospital in New Jersey. And you can pick these 28 hospitals. But when I look at this in terms of across the US, the data that I looked at in the last few days says there's over 6,000 hospitals, according to the American Hospital Association. So you do the numbers, and it's less than 1% have, now that's gone to the Baldrige level. But if you double that, triple that, you'll get 3, 4, 5% of our hospitals, rural hospitals, urban hospitals. We have several hospitals. I'll talk in a few minutes about the Mayo Clinic. But here where I sit in Minneapolis, I've been here long enough. I know the 8 or 10 hospitals that exist. We have several not-for-profits that are really on the fence right now in terms of financial viability. So, yes, there's been a lot of healthcare, a lot meaning 28 or 30, double, triple that, and maybe I could get to 100 that at least are going down the path. But out of what I look at, 6,000 hospitals in the United States, how many of them are aware of this excellence framework and the principles and the best practices and are actually doing it? Okay, also to stay in the world, there is the top 10 hospitals in the world, because we're talking about global here. Mayo Clinic is one. I've mentioned that. I'm very familiar with that. I've had colleagues and so forth that have gone down in terms of what Dawn mentioned earlier. They don't approach it at one doctor for cardiac, one doctor for your knees, one doctor for your feet, one doctor. You go there and you get, they call it an executive annual review. And you get 3 or 4 or 5 doctors assigned to you as a team to look at your entire system, your healthcare system, your entire body. So they're looking at everything from your mental capacity, and they do assessments on that. So they understand that this is a holistic look. It is not go to your cardiac doctor and get something, and then somebody says, oh, gee, you got to look at your pulmonary while they go to somebody else. Mayo Clinic does not do that. I sent some material in the last week or so to Dawn about the Mayo Clinic. They did a documentary in the last several years by our public television system here in the United States. And it went through the whole history of the Mayo brothers who formed the Mayo Clinic. And their focus was on, back then, it's been over 100 years, back then it was on patient focus, the entire patient. And then they hire doctors. Yes, do they pay them well? Yes. But they pay them a straight salary. There's no bonuses because you do more tests. So the Mayo Clinic, in most rankings, is considered a top hospital. However, Mayo Clinic can only do so much, and they make decisions about who goes there. So the access, in terms of what I mentioned earlier in some of these studies, access, everybody can go to the Mayo Clinic? No. You have to have certain kinds of insurance. You have to have people that perhaps recommend you to go there and so forth. So there's a selection process. So that access to the healthcare system is not necessarily all addressed through the Mayo Clinic. So you've got the Mayo Clinic. You've got another organization here in the United States, Cleveland Clinic in Cleveland, Ohio, very known, right up there with the Mayo Clinic. Then there's a University Health Network in Toronto, Canada. Then there's a Johns Hopkins University and Hospital in Baltimore, Maryland. And then there's others, Massachusetts General. There's one in ranked in Berlin, Germany. There's a Karolinska Institute in Stockholm, Sweden. Another one in France. So you can get a sense of the top 10 hospitals in the world. Find out what they're doing well. How does their focus? Because even in the case of the Mayo Clinic, I've heard them say, this is not private. I mean, a lot of their approach, I mean, they do a whole documentary. They allow the public television just to come in and do an interview with all the CEO on down on how they do things. So then you ask the question, why do not more hospitals do the same thing? Different incentive. So you can learn from that. That's part of the benchmark. The 10 managed healthcare agencies in the world. I asked the question earlier, how well did your healthcare agency do in terms of COVID? So if we can go here in the United States, can I look at the Centers for Disease Control? What are the top managed healthcare agencies in the world? People ask me, having worked in state government and worked with federal, would you work for the state government again in terms of healthcare? Some areas, yes, but some that are out there doing this kind of stuff, it's how do you sustain it? I work for Minnesota Department of Revenue, Florida. Did they sustain it at some level, but not consistent? And then you say top 10 managed doctors' offices, clinics in the world. So what you want to do and go through this is think about whether you take my list, what is your organization, and why would you list them as being there? But the net from all of this is, and this is part of our organizational excellence research, is whether it's the healthcare sector, whether it's the education sector, the others, if you ask a person on the street, what it tells us is maybe 5, 10, 15, 20%, small percentage of people, number one, know what this organizational framework is. Number two, organizations don't know what it is. So when I go on the street, if I go down and talk to some of the leaders at these other hospitals I mentioned here, our Hennepin County Medical Center and others, they're not aware of it. It hasn't been deployed. A lot of the Baldrige organizations have been out working with, as we call it, the coalition of the willing, but we got a huge opportunity out there amongst other healthcare organizations and beyond to say, gee, if 15, 20%, small percentage know what it is, we got an 80% market share that we're missing out there. So you want to ask yourself, look at these success stories. How do I become one of them? Maybe. How do I benchmark with them at some point? Maybe, but use this as a base. Why did they get there? You look at the Mayo Clinic and it's a commitment to that patient. It's a commitment to the patient. It's not a commitment to management. It's not when you ask students, why do they go into medical? Why do I want to be a doctor? At least here in the United States, not so much in other countries. It's because you can make a lot of money. Well, that's not a patient-focused approach. So you want to ask the question here, and where are the success stories across the U.S., whether it's the 26, 28 Baldrige winners or some of these others, how can I learn from that? Learn from them. And that gets me to my sort of closing slide here. A vision that I have. It's part of the healthcare sector focus. I think if we're going to move this thing forward in terms of healthcare involvement in the global excellence framework, but to me, in the next 5, 6 years, large percentage, pick a number. I'm trying to send a bold one, I would call it, a really bold goal here. 50 to 75% of our global healthcare hospitals, clinics, insurance companies, all of them are aware and are truly considered world-class leaders. So when you ask a continuing question, how is our healthcare system doing compared to our education system and compared to business? It doesn't always come out, well, healthcare is not doing as well. That we set some kind of target, vision, where all the performance of the healthcare sector are the most exceptionally led. Because as many of you may know, Dawn knows, I've been involved with this for a long time. I can see the data that exists on how well are Fortune 500 companies. I've worked in the business sector. I've worked in the public sector. So how does healthcare compare? There are some good ones. I mentioned that. 28 through the Baldrige. But as an entire sector, we ought to have some kind of vision. So what can you do now? You listen to all this. This is our approach within our organizational excellence specialist organization. Attend a 2-hour session. Get a little more detail on what this framework is, what the principles are, how we go about it, and how you can get involved. It's a 3-step process. Attend the orientation, complete an online self-assessment, and then get a result. What we do is go through these steps and get you to a point where you identify, based upon, yes, some external assessment, but also specifically saying, where are you today? If you were to do it in April 2024, where are you today in terms of these principles and best practices? Then we give you your list of strengths, areas of opportunity, and then we build this action report. How do you go forward? So if you are willing, you as an individual or you connected to your organization, are at a point to be able to say, I want to be part of this coalition of the willing. Everybody's not going to step up and do this. But if you're at a point where you get engaged, you got some inspiration from these outcomes we're talking about to build and go forward with this assessment process. And the good news is most of this work involves people in your own organization. I have done it in 2, if not more, organizations. I did it at the Minnesota Department of Revenue. I did it at the Florida Department of Revenue, where we went to just about all of the employees. In Minnesota, we had 3,000. In Florida, we had 5,000. So we asked input from all of those employees. How are we doing? Be open, be transparent, and build this. And most of the work, you can do this in a very short period of time. So the way forward is engage people like me, people like Don, people others. We've got 20, 30, 40 and more people. We got volunteers of a few hundred across the world to engage us at whatever level you like. We have a framework tool, turnkey toolkit to build a basis for it. If you want to learn more about one area or another, these are seasoned management and quality professionals. We work across all things from setting your vision and mission right down to working with cost-effective ways to implement this process. And our link is, because I've mentioned, you'll see the trend here of talking. So how do I go forward? How do I get over this barrier of not invented here? Okay, I'm a hospital in country X. How do I compare with Mayo Clinic, Johns Hopkins? How do I do benchmark? You can talk to us involved with the Global Benchmarking Network. We can talk to, there's an organizational excellence technical committee that Dawn is involved with the American Society for Quality. So there are other organizations out there. You don't have to do this standalone kind of thing. And most of those, as you'll see, are willing to share all of these success stories that are out there. It's publicly available information. This is not something like you might find in a startup where you got intellectual property and everything else. All of these, when they win a national award, they are held out for the next year or two to share them. But they're more than willing to do that. So we help, as part of OES, we help strengthen your performance going forward doing this assessment process. So that concludes my session today. What we want to talk about further is where you are as an individual or as an organization, and are you willing to be part of this coalition of the willing for the global healthcare sector to move us along, to get greater outcomes, to perhaps move your organization further along toward those outcomes, or move your healthcare system. So when we came back in 2, 3, 4 years, perhaps the ranking would be different and your outcomes for, as I started, for every individual in your country and our society as a whole. So thank you very much for being here, and we'll take further questions as we go forward. Hope to speak with you again soon. Thank you.
Thank you very much for your presentation, Dale. I really enjoyed the different sources of information you shared that captured what's happening on the global scene with regards to healthcare, and the benchmark examples that you provided, such as the Mayo Clinic. And this is indeed a challenge that you're throwing out, with 20% of the working population not knowing much about excellence and wanting to shift that. And your goal of, let's try to hit between 50 and 70% of professionals and organizations having some sort of awareness and applying this and doing well. So with that, we'll conclude the session, stop the recording, and shift over to some